Welcome and thank you for joining us today for this webinar about Out and Visible, the experiences and attitudes of lesbian, gay, bisexual, and transgender, or LGBT, older adults ages 45 to 75. A new study from SAGE of the fears, beliefs, behaviors, and aspirations of LGBT older adults, which offers important and startling statistics that have long been missing from our conversations about LGBT aging. My name is Serena Worthington, and I'm the Director of National Field Initiatives at SAGE, which stands for Services and Advocacy for Gay, Lesbian, Bisexual, and Transgender Elders. I'll be your moderator today. I am joined by Hop Backus, the Executive Vice President of States and Communities for AARP, Mason Davis, the Executive Director of the Transgender Law Center, Robert Espinoza, who is the Senior Director of Policy and Communications here at SAGE, Cheryl Wayland, who is the Executive Director and founder of SAGE Metro St. Louis, Bob Witeck, who is the CEO and founder of Witeck Communications. These noted experts will introduce themselves shortly. Before they do, I would like to thank the Ford Foundation for their generous support of SAGE's work to increase awareness and salience among policymakers and policy advocates about the unique ways in which LGBT older adults, particularly LGBT elders of color, transgender older people, and lesbian and bisexual older women are affected by public policies on aging related to economic security and benefits and employment. I would also like to extend a special thank you to Robert Espinoza. He is the Senior Director of Policy and Communications at SAGE, as I said. Today is his last day. After 5 years at SAGE, he is departing to serve as the Vice President of Policy at PHI National, an organization focused on transforming elder care and disability services by improving the lives of direct care workers, nearly 4 million home health aides, certified nurse aides, and personal care attendants. Robert authored Out and Visible, and I'm deeply grateful he's making the time to join us on his very last day. Thank you. In the same vein, I would also like to thank Mason Davis, Executive Director of the Transgender Law Center. This is Mason's last month at TLC, and he's graciously carved out time from what must be a very packed schedule to share his thoughts on this landmark report. Thank you, Mason. I owe you one. I'd also like to thank our remaining panelists, as well as the staff of AARP, Transgender Law Center, SAGE, SAGE Metro St. Louis, and Witeck Communications. I have a few housekeeping items for you. The webinar is being recorded and will be archived on the SAGE website. You will receive a link to the recording. Let's talk about the agenda quickly. Our panelists will introduce themselves briefly, and then we'll get to the body of our discussion today. Robert's going to talk about why this report was done, the methodology, and samples of key findings across sections, some key points and questions. Hop will talk about how the report is germane to his work at AARP. Bob will talk about what companies will do with this information and how it will be useful to marketers. Mason is going to talk about the relevance to the transgender population. And Cheryl is going to talk about how the report can be used on the ground, especially in regard to partnerships and outreach with mainstream providers. And then for our wrap-up, we'll do some final questions and send you the webinar survey. We're going to go next to introductions. Robert, please introduce yourself.
Hi, everyone. This is Robert Espinoza. I'm the Senior Director for Public Policy and Communications at SAGE. Thank you for joining.
Hop, say hello.
Yes, good afternoon, everyone. This is Hop Backus with AARP, and it's also my pleasure to be here today.
Thank you. Bob?
Hi, everybody. Bob Witeck here in your nation's capital, President of Witeck Communications, and proud to have worked with Robert and the SAGE team almost from the beginning to through design and execution, so very excited about it.
Mason.
Good morning. This is Mason Davis, Executive Director of Transgender Law Center. Thrilled to be here with you today.
And Cheryl.
Hi, everyone. This is Cheryl Wayland with SAGE Metro St. Louis in St. Louis, Missouri, and we're excited to be here as well. Thank you.
I'm going to turn things over to Robert at this time.
Thank you, Serena. Thank you, everyone, for taking time out of your day to join this webinar. It's a pleasure to be presenting on my last day here, so I do want to thank you. I also wanted to give a big thanks to my esteemed webinar panelists for joining us. I will offer a brief review of the report. I'm going to focus in on some specific key findings and then focus on some details regarding methodology. I encourage everyone to visit our full website to read the full report. I imagine that the data points that are in the in my presentation are going to raise a series of questions. So for brevity purposes, I'm offering specifically a sampling of the So with that, let's begin. So SAGE took on this study for a few purposes. The first was that we were interested in understanding the values, the needs, the wants, and the lifestyle preferences of LGBT people ages 45 to 75. Really, there were two large national trends that our research study were responding to. The first is that we're seeing increasing numbers of older people. In fact, it's estimated that every day 10,000 people turn age 65, and this will be the trend until the year 2030. We're also seeing a large generation of more out and empowered LGBT people, which is raising questions and opportunities for both aging providers, the business sectors, and other people in our respective fields. We consider this a uniquely comprehensive, nationally representative quantitative study on aging among LGBT older people. Next slide. The survey was conducted in March of 2014. It was an 18-minute survey with adults ages 45 to 75 to help inform the types of areas that we would study and the specific questions we would ask. In April 2013, we conducted a qualitative study. It was commissioned by SAGE. It was led by Harris Poll, which is a part of Nielsen Interactive. It was advised by AARP, and we also worked closely with Bob Witeck at Witeck Communications, specifically for guidance on LGBT households and markets. Next slide. This gives a quick review of the sample. The full report goes into more detail about specifics on the sample, but what's relevant to know are that we sampled about a little over 1,800 LGBT people, and for comparative purposes, we sampled about a little over 500 non-LGBT or heterosexual people. We were looking closely at differences across age at the younger end of the bracket in comparison to the older end of the bracket. We were interested in finding specific to male, female, and transgender respondents, and we were also looking at differences across race and ethnicity. One point to make here is that we achieved sufficient sizes in transgender respondents, African American and Hispanic respondents, to do a certain level of analysis. But as a point for future research and for future methodologies, one of the points we make in the report is that it will be really essential for data sets and for researchers to better count the number of LGBT people, specifically transgender older people, and the full diversity of older people across races. We also looked at this study and differences across household income. So as the slide shows, we're looking at 4 different income brackets, and we'll showcase some of the findings in this presentation based on those differences. Next slide. The first section that we studied was issues with aging. Next slide. So the main finding that we took from our study was that while aging is a common concern for everyone, what we found were that LGBT respondents were much more worried than their peers in a variety of areas. For time purposes, I'm going to focus on 2. One is that we found that 51% of LGBT older people in this study were concerned about having enough money to live on in comparison to 30% of their peers. We also found that 30% of LGBT respondents were concerned about not having someone to take care of them as they age in comparison to 16% of their peers. The next section that we studied, it was healthcare. Next slide. Here we found that in general, LGBT people were concerned and often did not report their sexual orientations or their gender identities to their healthcare providers. The full report goes into more detail. But when we looked more closely at the LGBT respondents in particular, we found some additional points, and I'm going to reference these right now. One is that 43% of LGBT older people who are single say their healthcare providers don't know their sexual orientations, which was much higher than people who were married or partnered. We found that 40% of LGBT older people in their 60s and 70s say their healthcare providers didn't know their sexual orientation. This was larger than the younger population. And we found that 2/3 of transgender adults felt that they would experience limited access to healthcare as they grew older. Next slide. The third area that we studied was finance and retirement. Next slide. We found here a few concerns worth noting. One is that 42% of LGBT older people were either very or extremely concerned that they would outlive the money they have saved for retirement as compared to 25% of their peers. And we found that 44% of LGBT people are very or extremely concerned that they will have to work well beyond retirement age just in order to have enough money to live on, in comparison to 26% of their peers. Next slide. When planning for retirement, our study found that in general, both LGBT and non-LGBT older people rely largely on their own knowledge and education. However, we found that LGBT people were more likely than their peers to rely on government tools when they were planning for retirement, and non-LGBT older people or heterosexual people were more likely than their peers to rely on the services of a financial advisor. Next slide. While most LGBT older people age 60 and older who were in the report reported being retired, among those who were not retired, they anticipated working on average until about age 69. We also saw that about half of all single LGBT older people believe that they will have to work well beyond retirement age in order to survive. In contrast, we found that 37% of LGBT older people on the younger end of the bracket, ages 45 to 59, anticipate that they will have to retire at age 65, and about 1 in 4 do not know when they will be able to retire. Next slide. Among the types of activities that both LGBT older people and their peers reported that they would like to engage in retirement were items such as leisure activities, travel, volunteering, starting a hobby, working part-time, and joining social groups. However, we found that LGBT older people were more likely to see themselves as mentors, and non-LGBT older people were more likely to say they would spend their retirement time with their family and their friends. Next. We also looked at the question of support systems. Next slide. In our findings, we found that about 1 in 3, or 34% of LGBT older people lived alone. This is in comparison to 21% of their peers. 40% of LGBT people said that their support networks have actually become smaller over time, which is in comparison to 27% of their peers. And here we saw that African American LGBT older adults were 3 times as likely as white or Hispanic LGBT older adults to say that people from their churches or faith were part of their support. Next slide. We looked at this question of housing. Next slide. We found that 1 in 10 LGBT adults have said that they have been discriminated against when searching for housing on the basis of their sexual orientation, and 1 in 4 transgender adults said they have been discriminated based on their gender identity when searching for housing. We also found that 44% of LGBT older people were very or extremely interested in living in an affordable LGBT-friendly housing development. By the way, on this statistics, when you also include somewhat interested in such development, the number goes from 44% all the way up to 78%. Next. We were interested in understanding the sources of information as well. Next slide. When seeking information on aging, we found that in general, both LGBT people and non-LGBT people were likely to rely on their internet as well as family and friends as their top sources. However, what we found was that among LGBT older people, women were more likely than men to rely on government sources, and men were more likely than women to rely on social media. We noticed a difference here in that we found that African American LGBT older people were much more likely than white and Hispanic LGBT older people to consult government sources when they were seeking information on aging. Next slide. We found that younger LGBT older adults, 45 to 59, were more likely to rely on friends and family for information, whereas older adults were more likely to rely on professionals and nonprofit organizations than their younger counterparts. Next slide. So what I've offered is a sampling of findings. Again, our esteemed panelists are going to be speaking about the implications of these findings and speaking a little bit more in depth about what it means for their work. Additionally, I would encourage everyone to visit our website specifically to access a variety of items. And next slide. On our website, you can access a few items. You can access the full report, which details all of the findings that I shared, as well as extensive findings in all of those sections. And next slide. And you can also access actually a poster, a downloadable poster that includes some of the key findings in case people are interested in showcasing this in the areas in which they work or in the areas in which they reside. That concludes my section, and I'm going to hand it over to Serena. Thank you, everyone.
Thank you very much, Robert. Let's go to our next presenter, Hop.
Thank you, Serena, and good day to all. It's my privilege to be in this most important conversation today. As you heard, I am Hop Backus, and yes, the name is Hop, and I have the greatest pleasure of working with ARP staff and volunteers across the country. We have state offices in every state. We're in D.C., we're in the Virgin Islands, and we're in Puerto Rico. And I really hope you're aware of our presence in your state and perhaps some of you even volunteer with us. If you're not, check us out. There are websites. And by the way, many of our state offices work closely with SAGE and other LGBT organizations. So you just heard from Robert about some highlights from this very important research. As I studied the report, I felt like I was reading about the many important issues on the AARP agenda. AARP has launched into 2015, and this last year we developed our goals and plans like all organizations. And there are three big areas that we're focused on. It's health security, it's financial resilience, and personal fulfillment. I had the privilege of looking at this research many weeks ago, and as I studied the research, I was reminded about the many things that are in the research. Really, are all the issues that AARP has worked on. And what I thought I would do here in the next couple of minutes is just pull out 3 or 4 areas, and then I'll connect the dots at the end why I pulled out these areas. First, I'd like to talk about isolation. Isolation is mentioned in the survey, and it is a concern of people having to live alone. Well, the AARP Foundation has as one of its critical works of area isolation, and what our research has shown is that isolation can be viewed as a health issue and can be compared to having cancer and having as serious implications. So what the foundation is doing this year, they currently have a request for information out, and what they're doing is identifying executive level representatives of organizations who can serve on a council that will direct and inform a national initiative to address isolation by growing awareness of the issue and identifying solutions that increase meaningful social connections. This is a recognition that there is a real opportunity to improve the definition and understanding of this issue. And I really encourage the LGBT community to take this request serious. Our voice needs to be at the table as our foundation is working on this issue. Another thing that we're doing at AARP around isolation, and you'll say, well, how is this? But I think you'll understand it. We launched a tech program this last year, and basically what we're doing is we're at the community level and wherever AARP can show up in venues, and we are teaching folks how to access data. We're teaching them, giving them skills for iPhones, BlackBerries, working computers, etc. It's an obvious answer to isolation when you think about it. First of all, it's about accessing information if you really know how to use the tools, the tools that are available to us today, and then as well connecting to others. Another area that was raised in the report, and I'm getting a little micro in here, but I drilled down in this. I saw some conversations in the survey about volunteerism, and volunteerism in the context of people really fearing discrimination as they're working in communities and working with organizations. We have a program at AARP that I think it's not widely known about, but I think it has great potential, and it particularly has great potential for people who want to do work at the community. It's called Create the Good. It really is an opportunity for an individual to take a look at their community. Obviously, we have a website, and we can give that information to you later, to go in and find out what's happening in the community. They might get involved. But as important is also if you have an issue that you want to work on the community, it gives you the ability to talk to folks in the community and find like-minded people who may want to work with you on an issue that is of concern to you. I would encourage for you all to check this out and share it with folks, because it really is an excellent tool for really creating some good work at the community level and giving folks ways of getting involved that they may not have thought about. Another area that I pulled out of the report was housing and affordable housing. It was very obvious from the findings that people are looking for a safe place to live openly and comfortable. ARP's research found that about 6 in 10 homeowners are willing to consider shared housing. And in general, 50-plus homeowners in a sample of the 50-plus homes, 32% of the homeowners would consider shared housing as they grow older. And an additional 19% would consider shared housing in the event they need additional income. So you ask, so how are all of these things germane to this conversation and the research? Well, I think the thing that is significant about this research is that it now gives us research as planners, as organizers, and leaders to take to our various organizations that speaks to, points up the needs of the LGBT community. Yes, as I said at the front of this conversation, ARP actually works on all of these issues, and we believe everything we do is for the 50-plus and their families. It's for everyone. But the important thing that we have here is really specific information that helps us as we advocate for systems, as we are providing services, and we want to provide improvements in services. So I would encourage our listeners to really to understand the research, to use the research. I think it's really going to help us build our agendas in more powerful ways. And I really want to take this time to thank Robert and Michael and folks at SAGE for seeing this project through. I think it's groundbreaking for us. It's foundational and it's transformational. And it's Hop Bacchus at aarp.org. Anything that you may want to ask me, please send me an email. And I'm fairly responsive. Pretty busy, but fairly responsive. So, Serena, I thank you guys for this opportunity just to have a few comments.
Thank you very much, Hop. We do have a comment from the audience that I'd like to share. Perhaps you can address it. This comes from Julian Spalding from the Rogue Valley of Oregon. He mentions that he serves on the AARP Oregon Diversity Advisory Council and thought it might be something you could talk a little bit about because it might be an option for folks around the country.
Absolutely. In our state, we have 53 state offices across the country, and they are a significant piece of our organization at the state and the community level. In each of these state offices, they organize executive councils, and they may or may not have diversity councils. Several of our state offices do have diversity councils. What I would encourage the listeners to do, Serena, and the questioner is, and thank you for the question, is to reach out to the state office. Find out where the state office is in your state if you don't know. Learn who the staff are. We do a big part of our work we do through volunteers. We have thousands of volunteers. We're always looking for folks who are concerned about the issues of the 50-plus, and particularly concerned about the issues that are raised in this research. So reach out to our state office and find out what kind of activity you can get involved in, and see if their diversity council is available. We don't have them in every state office, but many of our state offices have one.
Wonderful. Thank you so much for that added information, and thank you for your remarks. Next, we're going to go to Bob.
Serena, thank you very much. Actually, after that last question, I'm probably maybe the only one on the phone who knows where Rogue River is. I've been there. I thought it was named after me at one time. Anyway, thank you for including me. This is a project I love for many reasons, because it is trailblazing in terms of diving truly deeper into comparative samples. A lot of times in the research that's been performed the last 20 years in terms of LGBT perspectives, regrettably, we've often focused only on our own population. And this is important for the market, particularly. It resonates very profoundly with the market because it gives us a chance to show comparatively what makes aging for all of us the same and what makes it different for people who are LGBT. And this study, I think, does that in such a sublime way across a variety of deeper issues. And this started, I think, even before last year, was the notion of how much we could capture when you do a dive like this, because we know that the interests in the market are going to come from pharma, from home health care, from housing, as Hop was pointing out, a very important issue, across retailers of all kinds, also transportation, the nonprofits. There is in the sector, financial services, I should have added quickly. All of these are marketers that are trying to wrap their heads around the aging population because, one, they know the wave has arrived. It's not coming, it has come. And with boomers representing the largest economic force in the United States, I think today, segmenting the population is going to be critical. One thing we got out of the research too that I want to highlight a lot is for older populations, the words about visibility really resonate very deeply. This is an interesting phenomenon because those who you might have considered to be in the Stonewall generations, those who were adults in the 60s and the 70s and on, being an activist as a young person creates that fear as an aging person to have to continue to want to be an activist, but worried that your isolation, your invisibility, or the hostility you face in terms of aging providers makes it harder for you. And going back into the closet is a phenomenon that a lot of us have got to wrap our heads around, particularly in the market when people are less visible all of a sudden. It should be a wake-up call. But again, what the data told us too is that what people are looking for, if you looked at information sources, for example, their LGBT people are more apt to go to third parties where they don't have to self-identify necessarily. They're looking for government sources or online sources. In other words, they're not as apt to go to a financial advisor, for example. The fear is always being one of being judged. In the research we've done the last 22 years, the issue of being in the closet is profound across a lot of LGBT people. But the individuals that many gay people had said over and over again was the last person they were out to was their doctor. And for aging populations, that's the most high risk and dangerous place to be invisible, is with your care providers. So I think what we're learning here is the idea of not just a marketer or a provider being welcoming and identify gay people as important to their providing services, but to do so in a sensitive, respectful, and non-judgmental way. And one of the things I think marketers have a challenge with constantly is not only making that promise, but delivering on that promise and actually making it possible for people to feel when they go in to rent a property, to see a health provider, to sign up for insurance, to handle their financial assets later in life in their estate. It's to do it with individuals who respect and treat them equally and respectfully for who they are. And so they understand their background. And I think those are the things, the lessons I hope marketers are going to take from this. I think the opportunities for marketers are tremendous. The opportunity to respond and deal with these issues. And again, if a marketer learns from the data, I think these are actually lessons they could apply to lots of populations. The dignity that older people require means understanding them from where they come from. So with a diverse racial backgrounds, that you have cultural competency, including gay people, to take people as they come to you. And I think those are important wake-up calls. And what's happened here is with this research, with the SAGE insights, for the first time we can show that the numbers, the metrics that characterize these trends and take them into the audiences of, I hope, decision makers of all kinds, from public policy to people who are bringing services to the marketplace. Housing being a principal one. I take it from reading the data too is that more elderly people are likely to age in place. They may not be searching for another geography to go to live because their support system is smaller than it was, and yet it's so crucial to them that they are anxious to stay in their community, that they're known, where their providers are open to them and they're available to them, and they're not likely to move. So that's why I think, particularly in urban markets too, we're going to have to look at that in terms of delivering where people live today to third-party sites and locations where they may end up moving. I think I'll leave it at that, Serena, and welcome Mason and other points of view. But I'd be happy to try to respond to any questions that you have that follow up.
Thank you very much. Thank you so much for those remarks. I don't have a direct question for you at this time. We'll open that question period up again at the end of the panel. Next, we're going to...
Great.
Excellent. Thank you so much. And next, we'll go to Mason.
Great. Thank you so much, Serena. I am thrilled to be able to join you all today, and I'm very grateful for SAGE's work on this research and the report. I'd like to speak specifically about some of the healthcare data that emerged from the research. I was looking at the finding that transgender older people fear that they're going to experience limited access to health care and be denied treatment as they age, and that 2/3 of transgender adults feel they'll be limited access to health care as they grow older. Now, we have known for years now that health care access is a significant concern for transgender people of all ages in the United States, and it is not surprising to see that transgender older people are similarly, if not even more, concerned about access to quality and respectful care over the years. And I suspect there are a number of issues at play here. One is the concern about access to basic cultural competency, especially among transgender people who came out or transitioned in prior decades. The truth is this is a relatively new part of our community still, and many healthcare providers have not experienced training or support to know what the basic healthcare needs are of transgender people. And many transgender people, especially our older adults, have experienced significant and sometimes very severe discrimination and bias among healthcare providers, raising issues of trust and concern. And we know that many transgender people avoid care due to fear of bias even when they're sick, making it much more likely that transgender people will have health concerns that worsen over time. There are also concerns about affordability of care, especially given very high rates of unemployment and poverty among transgender adults, especially our older adults. And because of the affordability issue, people are typically very concerned about what services may or may not be covered by their insurance or Medicare plans, especially healthcare services that are typically restricted to one gender or another. For example, transgender women who have lived their lives as women for many, many decades still may need access to prostate exams, and yet that is very difficult to be covered under many insurance systems and their computer structures. So that creates a barrier for many people. In addition, there's a lot of concerns and questions about what kind of transition-related care transgender people may need throughout their lifespan and what will be covered, such as access to hormones like estrogen and testosterone, which most and many transgender people need throughout their lifespan, or medically necessary surgeries that might be a need for a transgender person at any point in their life, depending on their own trajectory and when they come out. Our group, Transgender Law Center, has been addressing this through vigorous advocacy, impact litigation, and pilot programs. And we've been especially concerned about the fact that so many transgender people don't feel like there is a doctor they can go to if they're sick, much less if they have specialized medical needs. So we worked closely with a community health center out in the Bay Area in the Western United States, Lion Martin Health Services, to launch a program called Project Health to increase access to culturally competent training for community care and healthcare providers. And we've been able to train hundreds of nurses and doctors and front staff and billing clerks to better understand the needs of transgender people, to be able to support them if they run into challenges throughout the healthcare billing and coverage system, but also to make sure that from the time they first step across the threshold in a health center, they can be treated with respect and get their healthcare needs met. Now, we know that not everybody will be able to access that training, so we also helped create a program called Transline, a warm line that provides technical assistance from experienced transgender providers for any provider across the country. It's not a hotline, there's not a phone number people can call right away, but there's a way physicians can submit a question through the internet, or leave a message, and get a call back by an experienced provider within 24 hours to help them with whatever patient issue might be arising. And we've also published toolkits to help grassroots community members partner with their community health centers to increase access to transgender care. And we have seen some areas like Los Angeles increase the number of community health centers and providers opening their doors specifically to transgender people exponentially. So it's great to see it when that kind of thing works. But we are still concerned that we have these 2/3 of transgender older adults who feel they will have limited access to health care as they get older. And while a lot of attention has been given to transgender youth in recent media, there is a significant need to ensure access to health care for our older adults. Meaningful access to quality, affordable care that meets the needs of our elder transgender people is an absolute priority for us, and it's one of the reasons we advocate at the local, state, and national levels for healthcare rights. Over the years, we've been very consistent in advocating policymakers about transgender healthcare. Originally, Transgender Law Center started as a California organization. We only became a national organization a couple of years ago. So we've done a lot of work in California using it as a bit of a petri dish. Was back in 2006 when we were instrumental in the passage of California's Insurance Gender Non-Discrimination Act, a law that prohibited insurance companies from discriminating against transgender people. And that was actually a pretty simple law given the time it was passed, the year it was passed, that said that transgender people should have access to the same procedures that are covered for non-transgender people, and that merely being transgender should not be a reason that transgender people are denied access to any insurance coverage or procedures that would be offered to anybody else. We've been able to build on that over the years and are currently working to ensure that public and private health insurance plans cover medically necessary care for transgender people, and that transgender people can actually access that care. So as part of that, we built on the initial work in California to work with the Department of Insurance, Department of Managed Health Care in California to have the state, for the first time ever in the United States, issue regulations eliminating discriminatory transgender exclusions from all health plans regulated by the state. And we now have seen 9 states in the United States follow suit. We have seen New York, California, Colorado, Connecticut, Illinois, Massachusetts, Oregon, Vermont, Washington State, and Washington, D.C. All issue these insurance bulletins eliminating transgender exclusions from plans. And that is a big deal. We are finally seeing people who have never been able to have access to coverage and care, actually scheduling appointments with their doctors and getting finally the care that they need, which is especially moving when you talk to an older adult who thought that they would never get the care that they've needed, and they can finally do that in 2015. Now, it's not an accident. We've been seeing a lot of progress on this front since 2012. We've been working tirelessly to ensure that healthcare reform and the Affordable Care Act would be meaningful for transgender people. For the states that have made this legal shift, it typically impacts the state insurance exchanges, the subsidized marketplaces for insurance that are being set up under the Affordable Care Act, and promises much more coverage of transgender people than we've seen in the past, which is incredibly exciting. So I guess a couple other things I just want to note before I turn over to the next person. We're also really aware that many people are impacted by other public and private health insurance plans. So we worked really hard to, for example, secure access to transgender care for retirees in the CalPERS system, the California Public Employees Retirement System, and most regularly and significantly, transgender exclusions were finally taken out of Medicare. And then older adults can finally access services Medicare that have been excluded until recent months. So this very, very new work and on the cutting edge of change in this area, but it's just the beginning, because removing exclusions or asserting that people should have coverage doesn't mean it's just going to happen. First, what exactly will be covered is under debate in many states, and second, many insurance companies can deny coverage, and oftentimes appeals are necessary. So especially for older adults that have a history and are used to things being denied, they may need encouragement and support to first ask for the care that they need, and second, to stand up for themselves if that care is denied, and to reach out to a group like Transgender Law Center or any of the other legal groups to ask for help appealing that decision. And I should note, we also have a supply issue because while Medicare now is covering this care, few health experts in transgender care are accepting Medicare. So we only have a handful, especially of surgeons, who will take Medicare, yet Medicare is not covering travel costs. So we need to resolve that issue to really make the Medicare coverage impact our community in the way that we would like. And deciphering what the law means can be confusing too. So oftentimes, community members and even professional care, social workers and advocates can be very confused about what's covered and how to get things covered. Last month we hosted a webinar on recent changes in law and policy in some states and at the federal level, especially the states I mentioned before and Medicare. That the webinar is available on our archive. Serena will include the link in the post-event materials we'll send out, so please don't hesitate to look at that and reach out to us or me if you have questions. And I just want to say I really appreciate everybody on the call and doing what you can do to help this part of our LGBT community increase access to care and confidence that they can get good care.
Next, we're going to go to Cheryl.
Hi, everyone. My name is Cheryl Wayland, and I'm the Executive Director of SAGE Metro St. Louis. And I just wanted to briefly give a disclosure that I also serve on the AARP Missouri Executive Council. So I really appreciate the support and work that AARP does to do outreach to the LGBT community. And in my brief remarks, I really just wanted to say that, you know, this report really gives us the data that we need on the ground as advocates working in the community. So often when we are seeking support from mainstream organizations or funders, the question is often asked, you know, what data do you have to support the need that LGBT older adults are more isolated or, you know, fear coming out to their service providers? And this report really gives us that data that we need to help build our case for better support and outreach for LGBT older adults. From a strategic standpoint, you know, we are using this data to help us forge new relationships with aging providers, including health, legal, financial planners, long-term care providers. You know, those services that, as a SAGE affiliate, we don't have a specialty in, and it really requires us to reach out to the mainstream providers in order to provide the best care for LGBT older adults. One of the things that we oftentimes hear about and continues to gain a lot of attention is inclusive housing and LGBT-friendly housing. And this comes from developers and the LGBT community alike. And one of the things that I really encourage us to think about is, you know, what does LGBT-friendly really mean? It's more than rainbow flags. It has to start with our policies, our procedures, and our best practices to really help ensure that LGBT older adults are receiving quality care. And from a strategic standpoint in St. Louis, LGBT inclusive housing, really it's looking at the community. It's looking at all the services available from a housing perspective. We continue to develop relationships with existing senior providers as well as efforts to assist older adults to remain in their homes and their communities. And some of the specific examples of this work include working with AARP in St. Louis and their Age-Friendly Communities Initiative, as well as village models such as STL Village that help people age in place and ensure that these efforts are inclusive of LGBT older adults and welcoming to LGBT older adults. We need to have a place at the table, and we need to ensure that our LGBT community is active in their communities. We're also currently experiencing an increased need in St. Louis for skilled nursing care. Just today we received a call from an older lesbian who is caring for her partner with dementia. And they've been trying to provide this care in home for over 6 years. But the time is nearing when they will need to look at placement options for her partner's needs can no longer be met at home. Over the next week, we will be connecting with our community partners to assist in developing placement options that can meet their needs and that we know will be welcoming to them as a couple. Based on the needs that we are seeing in St. Louis, it is essential that we continue to develop broad-based partnerships and relationships with mainstream aging providers that can provide the more specialized care that LGBT older adults may need as they age. So for the mainstream providers on the call today, I really encourage you to examine your policies and practices and to help ensure that they are LGBT inclusive, and to reach out to your local SAGE affiliates and LGBT community centers as we strive to provide broad and comprehensive menus of aging services that are LGBT welcoming. This report can be the guide to help you state the case to your boards of directors, to your funders, to really help ensure that your services are inclusive and that LGBT older adults are welcomed in their communities where they've lived, worked, and played their entire lives. And with that, I'll close my remarks. Thank you.
Thank you very much, Cheryl. I have one question that I'm going to pose to you that came in earlier. So the question is about outreach strategies for reaching older LGBT adults. I work at a clinic that is culturally competent, but what sort of outreach can be done to reach these populations?
I would specifically, encourage them to look around the community. Are there LGBT-friendly faith communities, churches? Is there an LGBT community center? Is there a SAGE affiliate? And if there is, make sure you're reaching out and building partnerships with those organizations. Another thing that we encourage folks to do is make sure that inclusive non-discrimination statements are visible on all, information.
Wonderful, thank you. And I got some clarification on that previous question. The question is essentially to address the difference between the results in the cisgender population and the transgender population. Why are those results so uneven? And I would put this to any of the panelists who want to answer it.
So I definitely saw there's a smaller sample size of transgender older adults compared to the LG and V identified sample. And, I think there are probably a few things and a few reasons behind that, and I'd be interested in Robert's take on it. Given our work, one of the things I know in the transgender community is there tends to be a lot of surveying and over-research in some ways for transgender people, and so it can be actually difficult these days to get a good sample size of transgender adults. There also are just fewer of us statistically, fewer transgender people than lesbian, gay, and bisexual people. So I'm not surprised to see a 10% or smaller sample size on this. I think still the findings that within the transgender sample are very consistent with what we've seen in research conducted specifically in transgender populations across the country. So it looks like good data to me even with a smaller sample size.
Thank you.
Thanks, Lisa. This is Robert from SAGE. Those are excellent points, and the 2 points that I would add to this is that there is in general a challenge, I think, in studying the realities of transgender older people in the same way that there's a challenge in studying the realities of LGBT older people of color, which is the structural challenge that very few national surveys include questions on in those studies. And so when we started this study, we were aware that we were going to need to work pretty intensely to get at least a sufficient sample size that could yield some statistically significant findings on trans older people. But what we found was that in order to be able to access and build a more robust sample of trans people, there were very few national data sets that had robust data on trans older people, and very few national email lists that had, especially in the older brackets, in the over 70, et cetera. I think it's a question that we believe that future researchers and future people who work in both the public and private sector who collect data should consider is what are the ways in which they're specifically accounting for identifying more data on trans older people. Because when that data has been collected in previous studies, it tends to skew wealthier, it tends to skew white, it tends to skew more educated at the older end of the spectrum. And so we ran into that problem as well, and I think it's a question that the research field as a whole is going to need to address at a larger level.
Thank you very much for that. I also have a question about the hotline. Mason, could you repeat the information about the hotline?
Yes, it's called Transline. If you Google it, I'll see if I can get a URL here. It's organized by Martin Health Services, but also implemented in partnership with other community health experts across the country as they respond to questions like Fenway Health and Mazzoni Center, Bay State Health. You can access it at project-health.org/Transline.
Thank you very much for that. And I want to thank the panelists for your time today. It's been an amazing, amazing webinar. I want to thank everyone for their attention. And again, a big thank you to our panelists. Goodbye, everybody.